If you have mesothelioma, you're probably worried about it spreading. Today I'm going to show you the 2 ways mesothelioma can spread, where it spreads, and then which treatments may slow it down. Hi, I'm Deborah from Surviving Mesothelioma. For almost 20 years, we've helped over 18,000 mesothelioma patients understand their treatment options. And we've also published the best-selling book, Surviving Mesothelioma, written by the world's longest living mesothelioma survivor. I'm gonna leave a link in the description where you can get it for free. Cancer is a disease that causes cells to grow and multiply where and when they shouldn't. As cancer grows, the cancer cells can spread to different parts of the body, and this is called metastasis. Every cancer spreads differently, and that includes mesothelioma.
Okay, so where does mesothelioma spread to? Mesothelioma tends to spread locally first,
and it tends to move into nearby organs. The most common type of mesothelioma is pleural mesothelioma, and it starts in the protective lining that is around the lungs. So when it starts spreading, it will usually invade other organs in the chest, like the lung, diaphragm, or chest muscles. But cancer doesn't always stay in one place. It can also metastasize. So when pleural mesothelioma metastasizes, it's not just in the chest anymore. It may have also spread to a distant organ like the liver, the spinal cord, or the brain. Does that mean every cancer will metastasize? No. Not necessarily. In fact, peritoneal mesothelioma starts in the lining around the abdomen and tends to stay in the abdomen. So even when mesothelioma spreads, it doesn't always spread to other areas of the body. Okay, so that's how the cancer spreads. But is there a way to slow it down? Thankfully, there are treatments and therapies that can help slow the spread of mesothelioma for some patients. See, when cancer isn't treated, it tends to grow faster and to spread more aggressively. But doctors have multiple ways to try to slow it down. Chemotherapy is a common one. It uses chemo drugs to kill cancer cells and to stop them from multiplying. This does not cure the cancer, but it may slow it down and keep it from spreading. Doctors can also perform a surgery on some patients to remove most of the tumor. That can reduce the chance that it grows and spreads quickly. They can also use radiation to attack the cancer and try to slow it down. Immunotherapy is another approach. It uses specialized drugs to boost the immune system and help it target cancer cells. And when the body can fight back harder, the cancer may spread more slowly. So the treatments and therapies that a patient gets and how well they work can make a big difference to how quickly the cancer spreads. Anyone who is worried about their cancer spread should talk to their doctor. They'll be able to monitor your condition and recommend treatments to make the cancer more manageable. At Surviving Mesothelioma, we help patients to understand their diagnosis and the options available to them. We've also worked with long-term survivors like Paul Kraus. Now, Paul is the longest living mesothelioma survivor in the world. Paul lived for 27 years after his diagnosis, and every day patients tell us that they wish they'd learned about Paul and his approach sooner. He put all of his survival secrets in his book, Surviving Mesothelioma, and it has every step he took, every therapy, every supplement, and every lifestyle change. Click the link in the description and we will send you a free copy straight to your door. Stay informed, keep fighting, never give up hope. See you in the next video.